Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, if you see the duodenal ulcers pathophysiology. So, in the pathophysiology of duodenal ulcers, actually, in the duodenum, the protective mechanisms are lost. The acid secretion in the stomach is normal, but here, because of the loss of protective mechanisms, this acid will reach the duodenum, and the duodenum cannot protect itself because of the loss of protective mechanisms. So, as a result, duodenal mucosa gets damaged with the acid which enters the duodenum. So this duodenal protective mechanism, most important is bicarbonate. So there is decreased bicarbonate secretion occurs most commonly in the duodenum, and sometimes there can be increased acid production might also be seen. That too, increased nocturnal acid production is also seen in certain cases. In certain cases, there is increased nocturnal acid production is also seen in the patients, and there is also increased duodenal acid load is also associated with it. There is increased daytime acid secretion may be seen. Increased pentagastrin stimulated monoamine oxidase may be seen, and there is increased gastric emptying is seen with decreased pH inhibition of gastrin release are also the important features of duodenal ulcer.
thank you and thank you for watching.